Learning how to spoon someone and being held might be incredibly traumatic for someone. And for somebody else, it might just be like, oh, I just love being cuddled and spooning, you just don't know. So, and a lot of times the client doesn't know either until they are confronted with something. And that is where the therapist is just a beautiful role because they can hold that amazing container so that after the client has had these experiences, they can go process and achieve whatever it is that they're looking to gain out of these things.
Well, thanks so much for being with us today. So let's get started with a question because some people might be unfamiliar with surrogate partner therapy. So, for anybody who's not sure what it is, can you briefly explain what surrogate partner therapy is and how it supports clients?
Briefly is going to be a little tough because it is a very complex form of therapy on some levels, and at the same time, it's just basic and very simplistic. Surrogate partner therapy is exactly that. You stand in as a surrogate partner for someone, working in a triadic model with their regular therapist or a sex therapist. Preferably somebody who's ASEX certified that is very aware of how surrogate partner therapy works. Um, and you stand in as a model, and rather than sending a patient or client out into the ethers of go find somebody on a dating site and figure it all out, you have a stand-in that is able to teach somebody hands-on how to converse, how to have eye contact, how to touch, how to really interact on an intimate level with another person. Most people think it's all about it's not. It's about connection and intimacy. Sex is the least of it, but it's very powerful work and very effective work.
Oh, I love that. So, what are some of the ethical considerations that professionals and clients should keep in mind with surrogate partner therapy?
Ethically, I think that there's a lot of mis I guess there's a lot of assumptions within society that surrogate partner therapy is sex work, and basically you're just putting a fancy word on prostitution. Um, with that said, there are some very conscientious and amazing sex workers out there. So this is not to mitigate or insult or anything the work that somebody is doing in a sex worker realm. But this is not that. This is therapy specifically for those who are sexually traumatized or maybe don't have never had any kind of healthy touch at all whatsoever in their life or are acutely or chronically disabled and don't have somebody to actually learn how to touch with, and are unfamiliar with their bodies, or maybe they've gone through transition and they have a new body that they're enveloping now and they're not really sure how to engage with that.
Yeah. Oh, I love that.
Yeah.
That's beautiful. I want to talk about the business side. So, how does
Mhm.
entrepreneurship play a role in building a practice around this work, and what challenges can come with that?
It's very interesting that you ask that because all of the work that I've ever gotten over the years has always just been word of mouth. There are people that I know in this field that do advertise. I don't know how well they do with that, because it is such, for lack of a, for I consider it, and I know a lot of other people in my field consider it very sacred work. It's very careful, and if you don't know what you're doing, you have a lot of power to actually cause more harm than help to a person. Um, so it's very important, I think, making relationships with other therapists, with other surrogates, with people who work in the field and know what your capabilities are in working with someone, and being able to recognize that I'm not just here to hustle to get work, that if I'm working with somebody or I meet somebody that probably isn't going to be a fit for me, I have no problem saying so and finding somebody who will be a fit.
Oh, yes, it's such a good philosophy.
Mhm.
So, I
Yeah.
know we already addressed one common misconception, but are there any other? Like, what other misconceptions are there about surrogate partner therapy that you find yourself addressing most often?
The first one being what we just talked about. The other, I think, being that it's kind of a one-stop shop and it's miraculously just fixes people. And as you know, people are pretty complex and there's a lot to us. And it's so important that people not just go like, oh, I'm just going to spend, 3 sessions with a surrogate and that will be that. And, while there have been like the movie The Sessions that was done about it, which was probably the only movie that I've seen that got pretty close to showing what surrogate partner therapy was about. But at the same time, like they said, there's going to be 6 sessions and this is how we do it. And it's not like that. You have to really create a plan that works for that person in front of you. And it might be 3 sessions, it might be 3 months, it might be a year. We don't know, and it's really guided by the therapist and the surrogate together as a team, making sure that we do our job right to work out of this client needing our help, whatever that looks like.
Did you know a lot of people watch our YouTube videos and never subscribe to our channel? Before you finish this video, take a moment to click subscribe. Yeah, I love that perspective. You can't go in with a blueprint saying this
Mm.
is going to work for every single person. This is exactly how long it's going to take. Everybody comes with their own individual issues and things that they want to work out. And,
Mhm.
everybody develops skills at a different pace. For someone, it might take a lot longer or a lot shorter. You just got to know your person.
Right, right. And you don't know where the challenges are going to be. Like it could just be like learning how to spoon someone and being held might be incredibly traumatic for someone. And for somebody else, it might just be like, oh, I just love being cuddled and spooning. You don't know. You just don't know. So, and a lot of times the client doesn't know either until they are confronted with something. And that is where the therapist is just a beautiful role because they can hold that amazing container so that after the client has had these experiences, they can go process and really achieve whatever it is that they're looking to gain out of these things.
Yeah, absolutely. So,
Mhm.
looking ahead, what do you see as the future of surrogate partner therapy in terms of accessibility, recognition, integration with other therapeutic practices?
I think that most therapists would probably be pretty open to SPT because, they see the value in that. Unfortunately, we're kind of in a really scary time in our society, in a rocky time, and it's hard to recruit people that feel safe or secure practicing SPT. In spite of the fact that nobody has ever been had any legal implications or anything around this. The world's a little different right now than it was even a year ago. And I would hope that there would be more room to expand so that people can actually be their whatever that looks like and feel in a safe container with their therapist. But right now, I don't know. I don't know what that looks like for the moment.
Yeah, yeah, fair answer. And so, if someone's watching this and they're like, you know what, I think I want to be a surrogate partner therapist, what would be the
Mhm.
first step they should take? What would you recommend?
Gosh, there's a group called the Surrogate Partner Collective, I think is what they are titled, and they are fantastic. They started a few years ago, and they are a group of surrogates and a group of therapists that also work with surrogates. And then if they're not in that collective, they know other people who are. They're based in Northern California, but they have the resources and everything laid out that anybody would be looking for. And they have the resources that people can be like, well, I'm in, I don't know, Michigan, you say, anywhere else in the country and not there, they will know who to connect you with. They're very, very well resourced, and I would say go there.
Yeah, amazing. Thank
Yeah,
you.
yeah, and well trained, and they have their therapists and their surrogate partners both constantly taking classes and keeping educated and staying up with the latest everything. So, yeah, a good
Yeah.
support network too.
Yeah, amazing. So
You
I
bet.
thought one more question for you. So what
Of course.
initially got you interested in this work?
You know what initially got me interested was that I had been doing just good old talk therapy with people and sitting across and same thing, reaching people that wanted to know how to um date or want 40-year-old virgin types, or and then I had another client that was chronically injured in a ski accident, and it was kind of like, well, where do I send these people? And here I was on the couch, and I wanted to just reach over and at the very least give them a hug. And no, well, where do I send somebody? How do I send somebody without going to a sex worker, which again is not a terrible field to work in or anything, but without putting my client at risk of any kind of solicitation or anything like that. Like, where do we go for this? And then in my search, I didn't find too many people that were actually practicing as surrogates. So then I was like, all right, I'm gonna do this myself. So when I'm working in one role, I'm not working in the other role. It's one or the other. Um, and if I'm working as a surrogate, then I have somebody else that is working as a therapist, which could be any number of therapists in our field. I don't do a lot of surrogate partner therapy anymore because it does take a toll on your body, not meaning like, oh, your body, but it's a whole bigger level of work. Um,
Hmm.
but yeah, it just felt like it needed to be able to do more.
Yeah, absolutely.
Yeah. Thank you.
Well, for anyone watching who wants to learn more from experts like Dr. Laurie Bennett-Cook, check out our website at sexualhealthalliance.com. We have events almost every month. They're online and in person. So check out our upcoming events calendar there. And thank you so much for being with us today.
You're so welcome. Thank you for having me. We'll see you soon.
Bye, everyone. Thanks so much for watching our video with Dr. Laurie Bennett-Cook. Do us a favor, share this with someone who might benefit from this information. Your support helps us reach more people with important sexual health information. If you are passionate about this space like we are, we know you'll enjoy these videos, so check them out. Please take a moment to like this video and subscribe to our channel. And remember, you are exceptional.